Hello, friends. This is Dr. Aishvarya Kaushik. Welcome to the Premier Endodontics and Conservative Dentistry Institute. Friends, first of all, before starting your countdown for your INI and your NEET examination has started, I hope all of you are working and studying extremely hard. This is the time to keep up your motivation, keep up your energy levels high, not get disheartened, right? And just keep your keep your hard work right up to the mark. Well, friends, today we are going to discuss a very important MCQ and the concepts and the discussion related to it. It pertains to your diagnosis and pain management in endodontics. So let us look at the question here. Yeah, the question is that the principal nerve fibers in the pulp or in the dental pulp are, right? The options B and C fibers, unmyelinated C fibers and myelinated A fibers, myelinated C and unmyelinated A, and so on. Friends, the first and very important thing while attempting MCQs, look at the question and try to get to the answer without looking at the options. The examiner is trying to confuse you, right? You look at the options, you get confused because the all these options you've read somewhere on or the other when you've been reading your entire textbook. So sometimes there is this problem of associating one concept with another concept and reaching the wrong answer. The first most important trick is to see the question and just try to understand the concept behind it, what exactly the examiner is trying to ask you. Not every time you can reach the answer without looking at the options, but just don't look at the options up front. Now, for example, this is a question which is completely based on hardcore theory. Principal nerve fibers in the pulp are. So we all know, according to Erlanger and Gasser classification, if we simply know the theory behind it, that based on myelination and based on the thickness of the nerve fibers, irrespective of whether we are dealing with sensory or the autonomic nervous system, the nerve fibers are basically divided into what? The basically divided into A, B, and C. Now, the pulp and the dentine pulp junction, they primarily receive what? The A fibers and the C fibers, right? Now, the A fibers, amongst the A fibers, it's the A delta fibers, which constitute about 90% of the tooth innervation amongst the A fibers. The rest 10% are A beta fibers. And then we have the C fibers, which are even more than the A delta and A beta fibers. They are about 3 to 8 times more in number as compared to the A fibers, right? Now, based on the level of myelination, C fibers are unmyelinated, right? A delta fibers are lightly myelinated, that is thinly myelinated. These are the two things that we are interested in. Once we've made a visual picture, record what we already know, then match what you know with the options. Answer is simple. Answer B, unmyelinated C fibers and myelinated A fibers. Right? The answer is simple. Now let us look at some other further details regarding this question. If we see, as I said, the Erlanger and Gasser classification, there is one very important point. Irrespective, it is not based on the function of the nerve. It is only based on the morphology, that is the thickness and the level of myelination of the nerve. We all know from general anatomy that the more is the level of myelination, right, faster is the nerve impulse conduction. So A delta fibers are thinly myelinated, conduct the nerve impulse at a speed of or a velocity of 3 to 30 meters per second. C fibers, which are unmyelinated and which are very thin, conduct at a very low speed. That's point number one, potential MCQ. That comes second. The A delta fibers, in terms of their position, are located more peripherally. What do we mean by that? That is they are located at the dentine pulp junction, and they are located, C fibers, C for central, they are located more centrally, where they're located inside the soft tissue of the dental pulp. Next very important point, the A delta fibers have got a low threshold of stimulation, low threshold of stimulation. So they are much more easily stimulated by, say, scratching with the help of a probe, right? By the small current that you put in your electric pulp tester, right? These C fibers, just centrally located, have got a high threshold of stimulation. So ultimately, when the caries is very deep, they have exposed the pulp and there is tissue damage. That is when the C fibers are stimulated, right? Normally. Next very important point, the A delta fibers, which are conducting the nerve impulse, the action potential very fast. So what happens? That the quality of pain is sharp, it's pricking, it's lancinating, it's knife-like, and it's most importantly, it is short-lived. The quality of pain of a C fiber is severe. It is, first of all, it is continuous for a long duration, dull. It's deep-seated or boring, deep-seated, throbbing pain. Please remember, all of these are MCQs. All of these words are MCQs. Throbbing pain, longer duration pain. The next important point written in the chart here, in the diagram here, they are A delta fibers are more sensitive to cold. The C fibers are more sensitive to heat. That is why clinically, when we ask the patient, is the sensitivity more to heat or cold? If he says the sensitivity is more to heat and less to cold, we are in a bad situation. There's more tissue damage. There is more deeper, involvement of the pulp. When the patient says, no, the pain is for a few seconds, more to cold, less to hot, then we are like, okay, fine. Probably this case is somewhere in reversible pulpitis stage, and we can avoid a root canal and we can do a restoration, right? So that's the clinical correlate. Now, this was about the sensory innovation. This is all about the sensory innovation that we're talking about, right? What about the efferent or the autonomic innervation? Now, you all know the autonomic nervous system from our basic pharmacology. Autonomic nervous system divided into what? Sympathetic and the parasympathetic. Now, let us just look at the parasympathetic first. Now, there is no clear-cut evidence that parasympathetic innervation even exists in the dental pulp or not. So this point is clear, right? No doubt. Parasympathetic innervation, no details you have to remember. Sympathetic innervation. Sympathetic innervation are the post-ganglionic nerve fibers that enter the dental pulp, and they are in very close proximity to the branches of the carotid vessels, right? The carotid artery. And their most important function is the regulation of microcirculation. So when they are stimulated, they cause vasoconstriction. That's one, right? What is the second most important point? Which is this ganglion that they're coming from? This is the superior cervical ganglion. We're talking about the superior cervical ganglion, right? Fine. So this was about the innervation of the dental pulp. Now let us just see the position, just to get this A delta and C fibers, and more importantly for us, the sensory nervous system, right? This is all we have to know about the sympathetic and the parasympathetic. But sensory is more important for us, right? Because it's part of the pain pathway, right? So let us just see the position of these A delta and C fibers amongst from the perspective, or from the perspective of the larger picture of the trigeminal pain system. So you can see here. Now, friends, just see this, very important. This diagram, this is for image-based question. This diagram I've taken from Cohen. This diagram I've taken from Burkitt. Conceptually, both are the same. So let us just see them side by side and compare. A delta and C fibers innervating the tooth. So these are the terminal nerve endings of the first order neurons, which are going to synapse where? They are going to synapse in the middle cranial fossa at the level of the trigeminal ganglion, also known as the Gaussian ganglion. Now, friends, this pain pathway, I'm doing this in very short here. Detailed discussion is for another day, right? Now, the central afferents of this first order neuron is going to go and synapse where? In the brain stem. Where in the brain stem? In the medulla. And where in the medulla? Nucleus caudalis, right? From here, they're going to change sides. From here, they're going to change sides, right to left and left ones to the right, and they're going to ascend to the thalamus. So this is the trigeminothalamic tract constituting the second order neurons. And from the thalamus to the cerebral, they constitute what? The corticothalamic tract constituting the third order neurons. And it is finally at the level of the cerebral cortex that pain is perceived as pain, right? So this was the Cohen diagram. Let us look at the exactly similar diagram, but this is more of a, you can say a coronal section. This is a sagittal section, this is a coronal section. So let us see A delta and C fibers, that's your nociceptors, that's your first order neurons, right at the middle cranial fossa, trigeminal ganglion. They go and synapse where? At the nucleus caudalis, right? Nucleus oralis, interpolaris, the entire medulla oblongata is innervated by them. But the maximum density is in the nucleus caudalis. From here, see, this is a very nice section here because this is showing the change in sides, right? So right to left and the left ones to the right, they go and ascend into the first, the thalamus. That's one of the milestones, and then finally to the cerebral cortex where the pain is perceived, right? So this was about today, friends. Just in case you want to take a full course with my academy, you can contact me. You can simply, this is my contact number, my email ID. Simply, go to Google and type either my name, that's Dr. Aishvarya Kaushik, or Premier Endodontics and Conservative Dentistry Institute. You will be directed to the website, and you can take both our theory and the practical courses there. I wish you all the very best. That should be it for today. Best of luck. Okay.